Okay, so we talked about the importance of keeping your blood sugar in that little window, that sweet spot there that we want it. And and we talked about kind of how it does it, right? We got insulin. Insulin lowers our blood sugar to keep it from getting too high. It puts it away when it needs to be put away. It lets it into the cells that need them. And then you've got glucagon. When it starts getting too low, glucagon gets released. It kind of releases some of those stores and stuff. Some of the problems that we can have with our blood sugar uh, is sometimes that system fails. Um, Two main ways that system fails. Let me go through the can here. Uh, and they lead to type 1 and type 2 diabetes. So I'm going to start out by talking about type 1 diabetes. What we've got here is when we got the problem with type 2 diabetes is we talked about when we right this chunk of the intestines, right, and gets glucose, gets absorbed, comes over here to the pancreas, right? Pancreas, beta cells release insulin, right, and it stores it in the liver, and it goes off to the body, right? Stores in the body too. So this process, something must go wrong then in order for somebody to become diabetic, right? Then draw a few more islets in there, right? The islets in Langerhans, you can, I think you got them all the way up to the tip. Anyway, where the problem is in type 1 diabetes, problem is that the beta cells get destroyed, right? Beta cells can't fail, I'm going to say, to release insulin. Well, hell, we know what's going to happen there, right? They're failing to release insulin. Of course. Now, glucose can't get into cells, can't get into the storage areas, can't get into the cells. We're eating, but it's just floating around in the blood, right? So our blood level is going to end up really high. So no insulin, right? Comes out here. We got this cell here that I blew up before there, right? It's got all these receptors on it. Got these receptors here. We'll stick with purple on it. And we got this glucose floating around. I think I made that blue before, didn't I? Might as well stick with blue. Right, we got all this glucose coming out here. Remember, it's coming down. It's getting pushed into the interstitial space, but it can't get in the cells. Can't get in the cells in the liver to be stored as glucogen. Can't get into the cells of the muscles to be used for energy. Can't get into the cells in the brain to be used for energy. That's the most important thing. That's the thing you're going to see first. So anyway, what's going to happen with this person? He's going to get lethargic, right? He's going to have lots of problems. He's going to get fatigue. He's going to get lethargic. A lot of times in this type 1, the first time, the way this person finds out that they are diabetic is they come into the hospital in ketoacidosis. Right, and ketoacidosis, I decided that we're not going to talk about that, at least not right now. I'm hoping that we can get to it. I'm hoping we can get to it. You know, in all honesty, we probably won't get to it until next time I have you in complex. I would have liked to get it here, but I think it would be a little bit much to toss that on top of there. But what ketoacidosis is, make a long story short, there's a lot to ketoacidosis. But what it is you don't have any. You're a type 1 diabetic, and you didn't know it, or I'm telling you just from experience, you're a 16-year-old kid who decided I don't want to be different than everybody else, so they quit taking their insulin. Right? Tells mom, yeah, I'm taking my insulin. Boom. Next thing you know, he falls on his face. He's comatose. He's laying there breathing really fast and hard. So what happens in ketoacidosis? Your blood sugars go sky high, but your cells are starving. You got lots of glucose out there in the cells because none of it's getting put away. Your cells are starving. They have no energy source. So they use lactate, or I'm sorry. So they end up burning stores, right? We end up burning alternative sources of fuel, your proteins and your carbs, or in your fats, right? So you start breaking up those fatty acids, you end up with a lot of ketones. Ketones are a byproduct of fat breakdown. That's why people like that keto diet, because if you check yourself, I think they got when you're on a keto diet, a little thing that you pee on, if you got ketones, well, tell me, if you're trying to lose weight and you got ketones in your pee, that's a good sign because you're breaking down fat. Well, this person here is breaking down fat even if he doesn't have any, right? It might be a little skinny guy. He's breaking down fat in places where you don't really want to break down fat is probably what's going on. But he's got to break down fat or he won't live. Ketones are kind of a funny thing. They'll feed the brain and the heart, the two things that have to be fed. They're an emergency source of energy. Don't feed other things. They'll break down and they'll feed, and they can do that for a while because they're selective on what they feed. They'll feed the brain and the heart, and they'll keep you alive. You might be just laying there, and what happens is ketones are acidic. You're gonna have ketoacidosis, right? You're gonna be acidic because when you burn, like I've told you before, the system, in order to burn clean, right? If you have a wood burning stove, you burn some nice hardwood oak, it burns nice and clean. You get lots of good heat off of that, and you're not making your house all smoky. You take some pine, stick it in there, your house gets smoky and stinky, and it burns really fast. It's not a good source. Well, this here, if you want to burn clean, if your system wants to burn clean, it'd kind of like the oak wood in your stove. It's got to have a good source. It's got to have glucose. It's got to have two things. It's got to have glucose. It's got to have oxygen, right? Same thing happens in your wood stove. You start starving of oxygen, it starts smoldering. Right? I think I might have told you the story about my sister when her house burnt down. It didn't have oxygen. It was smoldering like crazy, and her mattress was smoldering like crazy. And she opened up the window because it was so smoky in there. Because that's how smoke does. It really you get a lot of waste product when you don't have the oxygen. She opened up the window, boom, the house burnt down. But anyway. Back to the source, back to the story here, back to what counts, is your cells have to have glucose and oxygen, to burn clean. It has alternatives to that. It has alternatives to it. Doesn't have glucose, we go for the ketones, right? We start breaking down our fat, and we produce ketones, and we end up in ketoacidosis. Um, and if you don't have oxygen, not that this is part of the diabetic story, but if you don't have oxygen, you use lactate to replace the oxygen in the Krebs cycle, and you end up producing lactic acidosis. You end up producing lactic acid. But in this case, what we're talking about is a type 1 diabetic isn't getting glucose into his cells, needs an alternative source of energy, starts burning up fat and protein, and it gets all this waste product because it doesn't have the good stuff to burn. It doesn't have the glucose and the oxygen. It's got the oxygen, doesn't have the glucose. Got to have both of those, glucose and oxygen, if you want to burn clean. Doesn't have glucose, so it's burning dirty. It's producing a lot of acid, right? So you end up in ketoacidosis. So that's probably type 1 diabetics. A lot of times they don't know they're diabetic because this happens. Usually it can happen it happens suddenly. And the story behind it is some people, what happens is our immune system, this is an autoimmune thing, our immune system ends up attacking the beta cells and destroys the beta cells. And there's some families have a better propensity to having this happen because for some reason in this line of persons, they have beta cells that are M marker, which is the marker that says I'm part of this body. Don't attack me, right? So this marker, this protein marker on these cells saves these cells. There's nothing in them. There's no immune cells. None of these white blood cells are programmed to kill that, to kill self. They're not supposed to be anyway. Unfortunately, some of these people happen to have their markers are close enough to certain infections, certain viral infections, certain whatever. So they're not born with the type 1 diabetes, but they're pretty likely that they're going to end up getting it as soon as they happen to get this one particular virus that's so close, or this one particular bacteria. I think it's usually a viral infection. And they get the infection, they get better, and they think that they're just fine. But now they have an antibody in their system that, right, is confusing the beta cells for the viruses that it's just killed. And it's just now been primed to kill these guys. So now you've got this. And so it just keeps working on them. It just keeps killing them. Boom, boom, boom. Before you know it, the guy's diabetic, doesn't know it. Running around, starting to feel really crummy. Starts what kind of symptoms he's going to get? He's going to get really thirsty. He's going to get really hungry, right? He's going to eat, because all his cells are screaming for energy. They're all screaming for something, and he just keeps eating, right? In fact, they usually will want something like fruit and something sweet. He's going to crave this because the cells want this glucose. So as he's craving this stuff, he just keeps eating. And then the sugar, what happens is the sugar builds up, right? It builds up in the blood. Now, normally what happens, right? I'll make it blue, what the hell, right? We got the kidney here, right? So here's our kidney. We got, and what happens in the kidney, right? God, kidneys come up a lot. So I get lots of practice drawing nephrons. Because it comes up all the time, because the kidneys are very important, right? And then you come out these tubules here. So this here is the nephron. It's the functional unit of the kidney, right? I tell you that all the time. That's going to be really important someday. But you got our kidney out here like this, right? You got the kidney cortex, the nephrons in here, and it kind of hangs down like this. It goes into this collection tubule, which comes on down and out like that. But the reason I'm bringing up the kidney right now is because what happens here, you're getting all this glucose is building up inside. You're eating and eating and eating. Yet your cells are screaming and screaming and screaming, eat more, I'm not getting anything down here. So you just keep eating, you just keep on eating, and your blood sugar is just going crazy, crazy, crazy high. So now you've got all this sugar out here, right? It's all in your blood. And what happens is you get, the way the kidneys work is you get the blood comes in, it gets pushed in, right? It comes in here, comes out, and goes to all of these. There's a million of these little suckers inside here. A million of them in each one of these kidneys. So it comes in here, gets pushed in here, and the pressure on it pushes the filtrate through. It pushes a lot of the plasma out of the blood, all the little stuff. Glucose fits through there too. But what's supposed to happen, right? You get this filtrate. I'm going to make that orange. Right, you get the filtrate. This is called Bowman's capsule. So it gets pushed out of this little glomerulus is what it is. It's like a tuft of specialized capillaries, and it gets pushed into the Bowman's capsule and comes down this tubule. And what happens is it comes all the way down like this and follows it down here, and it goes through this little distal tubule, then out there, boom, on out to the ureters, right out the urethra. Pee it out. So, but we don't want to lose our glucose. Glucose is hard to come by. Historically, as an animal, we were out there, we were eating stuff, we were eating a lot of crap that didn't have a whole lot to it, right? You don't always have apples and nice fruit around to eat, so you're eating, leaves and lettuce and whatever you can find, and you kill a rabbit or something. But you're not getting you're not getting a lot of glucose, so you're not going to waste it. You don't want to be peeing it out. You know, you worked hard to get this stuff. Not anymore, unfortunately. We just go down to Hy-Vee or Walmart and pull it off the shelf. But anyway, we come through here. Glucose, 100% of glucose gets reabsorbed. And most of it gets reabsorbed right here in the proximal tubule. And what I mean by reabsorbed is it comes back out through here, right? You've got it over here. You start throwing everything that's good, potassium, sodium, all this stuff. You take it and you shove it back out here. And this part of the after that goes through the glomerulus, this part of the capillary, this part of the artery, it comes in, goes through the glomerulus, comes back out, and then comes right down here. So everything that gets pushed out there, it will absorb it back into the bloodstream and back into the system. Well, what's happening here is you've got so much sugar in here. Remember I said you got so much sugar because this guy's eating and eating and eating and nothing's getting into the cells where it's got to go. Nothing's getting stored in the liver. Nothing's going into the cells to be used, right? So this guy's blood sugar is so high, it gets pushed in here. There's so much sugar. It absorbs what it can, but it can't absorb that much sugar. So we call it spilling over. We get sugar spilling over. So this sugar comes on in here. And some of it gets absorbed. A whole hell of a lot of it just comes right on out like this. And because of the osmotic pressure over on this side here, normally all the stuff has been pulled out of this, so it's osmotically, it's very weak, right? It doesn't have a lot of osmolytes anymore. So by the time it gets down here, we can get most of our water back, right? Because everything's been taken out of it, right? We've pulled our sodium out, pulled all the potassium, the magnesium, the calcium, right? We've gotten all that stuff back out of the urine. Only the waste products, the urea stuff is coming back out here. And so we want to get rid of that. Now it's osmotically. And what is osmosis? Osmosis is the the movement of fluid or water from an area of lesser concentration to an area of greater concentration of solutes. So if you have more stuff over here, the water wants to absorb into that. So here you have more stuff outside here, right? Or I'm sorry, normally you have more stuff outside here, right? So the water will get absorbed so we can save most of our water too. But in this case, you got all this sugar. Sugar is a solute, right? Sugar is some stuff. And so this is still full of sugar. So you're not reabsorbing the water here. So the water goes straight on out. So you're peeing, right? Because this water is not getting reabsorbed back here. It's just going out. Boom, you just keep on peeing. You can't stop peeing. So, man, you're thirsty as hell and you're dry. You're drinking, but your lips are all dry. Your skin is dry and you're craving more and more water. So you're trying to eat because your system wants this glucose. You're trying to drink, and you're peeing, right? So they call it polydipsia and polyuria, right? Polydipsia means that you're always wanting to dip into the water, right? And drink. Polyuria means that you're urinating like crazy. So as this goes through here, and polyphagia, I think you got like 4 polys, but so you're hungry. So as you're losing all of this water, you're getting really dry and you keep on drinking. So that's what this guy's doing, right? As I'm talking, this guy here with type 1 diabetes, right? He got a little infection, fought off the infection, feels fine. Decided that or thought that he was just fine, but all of a sudden, you kind of notice, man, he's drinking a hell of a lot of water. I just keep it, and I'm always hungry. And maybe mom. It's usually mom that notices. How come you're drinking all the time, man? You got that water bottle with you, you're just slamming it and filling it up. What's going on? Hopefully you got a mom around because they're usually the ones who will notice it. It's not usually the teenage kid that notices this. And they'll bring them in with those complaints. Hungry, fatigue, going to be really tired because cells aren't getting anything. And it's starting to get kind of confused, this stuff too, right? Because maybe the brain's not getting fed like it should. But then you get the ketones out there, right? But now you're getting acidic. So now you're feeding your brain and your heart to keep yourself alive, but you get acidic. If mom doesn't notice, somebody's going to notice when the kid's laying there flat on his back, breathing like crazy, going. I'm getting a little dizzy. So that's when you're going to notice kids laying there comatose, and he's got these Kussmaul respirations. The Kussmaul respirations are just a response to this acidity. You get a lot of acid in yourself, right? You blow off the acid, so you just start breathing really hard and heavy, and your system is doing that. Chemoreceptors inside your aortic arch, and I think there's a couple somewhere else, like in that artery right there. But so they are releasing. They're telling yourself to breathe, right? They're going up to the brain center, the breathing center, saying breathe fast, because we got a lot of acid in us. Because that's what tells us to breathe. This is the amount of acid. It's not a lack of oxygen. It's too much acid. So we blow it off, because normally we got a lot of carbon dioxide, right? But in this case here, they're blowing this off, right? And they're breathing really fast. These Kussmaul respirations, and you're going to smell this. You're going to smell this in their breath. When you walk in the room, you'll notice that this is an odd and funky. They call it a fruity smell. I guess that's a good enough smell. To me, it smells like somebody who drank whiskey all night. You know, that smell in the morning. But so now you've got a guy coming in here, and that's how we found out that he's diabetic, right? He's type 1 diabetes. He found out maybe he went into ketoacidosis, or maybe he happened to notice the symptoms on time to go to the doctor. But what's happened here is he has no insulin coming up here to land on here. Remember what I said. You take the insulin guy, you got to have that insulin come here, and it lands and makes that cell membrane permeable, and then the glucose can get in. He doesn't have insulin because he's got this. He's had all his beta cells destroyed, so he doesn't have the insulin. So he doesn't have that thing going on there. So all these guys are still out here. You got all this blood sugar, all this sugar out here, but you aren't getting it into the cells where you need it. Type 1 diabetes. And we'll talk about type 2 diabetes, but I got a little polyuria going on right now, so I'm going to go. I'll be right back. Finish this other part. I guess I don't have to tell you that, because I'm going to just shut it off. You wouldn't even know that I was gone.